My out-of-town patients typically drive or fly into Dallas the evening before surgery and get checked into the hotel. I meet them here bright and early the next morning. We meet in person. Of course, we've already talked on the phone or FaceTime or Skype extensively, but that day we meet in person, review a physical exam, of course, to do either vaginal measurements or talk about labiaplasty, different incision choices. We review consent forms and make sure that all questions have been answered, and then we actually do surgery that same morning. Patients go back to the hotel. All patients need to spend the night in Dallas that first night after surgery. If there's any reaction to medication or there's any bleeding or any issues, both myself and this anesthesiologist want patients nearby so we can help. If patients drive back home or fly home, if there's any problems, we can't help. So I want patients in Dallas that first night. For labiaplasty patients, they can go back the next day. Ideally, I like them to come by the office before they drive or fly home so I can just check on the stitches before they fly home. For vaginoplasty patients, I want them to stay in Dallas usually for 3 days. That third day, they come back and have the catheter removed. After the catheter is removed, it's best if they stay in Dallas at least 24 hours later just to make sure everything's going fantastic before they fly back home or hit the road. So for instance, my Monday surgery patients usually fly into Dallas on Sunday afternoon and then fly home on Friday morning. My labiaplasty patients would probably fly in Sunday afternoon and then fly home on Tuesday morning. So it depends on the type of surgery that patients are having.